Today we will cover the CURB-65 score and how we can use this to assess the risk of mortality in patients diagnosed with pneumonia. There are a number of signs and symptoms which the patient may present with to indicate a diagnosis of pneumonia, and this can be obtained from taking a comprehensive history, examination, and, if available, doing appropriate investigations. Now, the patient may present with a number of symptoms, and this can include shortness of breath. The patient may say they've had a productive cough, fever, pain on inspiration of the chest, and this is known as pleuritic chest pain. The patient may have recently started coughing up blood, which is known as hemoptysis, and the patient may just feel generally unwell, which can include having a loss of energy, lack of appetite, and feeling fatigued. We can follow this up by doing an examination, and we may notice reduced chest expansion on inspiration and expiration. On percussion, there may be dullness, and on auscultation of the chest, we may hear focal coarse crackles to indicate inflammation of the alveolar sacs, which is something that we see in pneumonia. By taking a history and examination, we can make a clinical diagnosis of pneumonia, but we can support this in secondary care by doing a chest x-ray, which could show signs of focal consolidation, which will further support our clinical diagnosis of pneumonia. Once we have made a diagnosis of pneumonia, we can use the CURB-65 score to make a mortality risk assessment of the patient with pneumonia. Now, if we make the diagnosis in primary care, which means in the community, we will use a variation of the CURB-65 score, the CRB-65. In secondary care, we will use the full CURB-65 score. And from this, we can obtain the mortality risk score for the patient with pneumonia. And this is the percentage likelihood of death occurring within the next 30 days. And based on the mortality risk score, we can decide where the patient can be treated for pneumonia. This can include home care, escalation to hospital management, and more seriously, ICU assessment in patients with the highest mortality risk scores. The CURB-65 score is broken down into a set of 5 components, and each of these will score 1 point if the following conditions are satisfied. The first part is confusion, and we can obtain this from the patient's history of presenting complaint, and there could be signs of new disorientation to person, place, or time. If there's doubt about confusion, we can do a more formal assessment using the abbreviated mental test score, and if the patient scores 8 points or less, that will also score 1 point for confusion. Following this, we do urea blood levels, and we can obtain this as part of the urea and electrolytes blood test, and any level greater than 7 millimoles per litre will score 1 point for urea. The important thing to remember is we don't normally use urea in primary care assessment because of lack of availability of doing urea levels in the community. Following this, we do the respiratory rate, and any level greater than or equal to 30 breaths per minute will score 1 point. Following this, we do blood pressure, and we can use either the systolic or diastolic blood pressure, systolic being less than 90 or the diastolic being less than or equal to 60. And finally, we look at age. If the patient is greater than or equal to 65 years old, that will score 1 point for age. After calculating the CURB-65 score, we can determine the level of mortality risk to the patient, and based on this, what is the best way to manage them. In primary care, this is a maximum of 4 points compared to 5 points in secondary care after taking the urea levels into account. The risk is broken down into low, intermediate, and high risk. In primary care, low risk is 0 intermediate is 1 to 2, and high risk is 3 to 4 points, compared to secondary care where low risk is 0 to 1, intermediate is 2, and high risk is 3 to 5 points. And based on this, we can determine their management approach. So if the patient scores 0 to 1, then we can consider home care. If the patient scores greater than or equal to 2 points, then we can consider hospital assessment, and patients scoring greater than or equal to 3 points are deemed appropriate for ICU assessment. This was the CURB-65 score and how we can use it to assess the risk of mortality in patients diagnosed with pneumonia. Thank you for watching.